Ovarian cancer does not have a standard screening test like breast cancer or cervical cancer. Because of that, it's harder to find ovarian cancer at an early stage when it's easier to treat. It's important for every woman to be aware of the signs and symptoms of ovarian cancer so that they can seek medical attention promptly if needed. While these symptoms can be indicative of various other conditions as well, being vigilant about any persistent or unusual changes in your body is crucial. In the video, we'll tell you about 4 ovarian cancer symptoms that every woman needs to know. So before we start, kindly subscribe to this channel for more informative videos. Let's get started. Number 4. Abdominal or pelvic pain. The pain in ovarian cancer may be caused by the tumor itself, which can grow and press on nearby organs and tissues. Additionally, the spread of cancer, metastasis, to other areas in the abdomen or pelvic region can also contribute to pain. Abdominal or pelvic pain can be a symptom of ovarian cancer in women. However, it's important to note that abdominal and pelvic pain are non-specific symptoms, meaning they can be caused by various conditions and are not necessarily indicative of ovarian cancer alone. Many women experience abdominal or pelvic pain for reasons unrelated to cancer, such as menstrual cramps, gastrointestinal issues, or urinary tract infections. Persistent pain or discomfort in the abdomen or pelvis is one of the key symptoms of ovarian cancer. It may feel like a dull ache, cramping, or pressure that doesn't go away. In the early stages of ovarian cancer, pain might not be a prominent symptom. As the cancer progresses, the pain may become more persistent and severe. Certain activities or movements, such as sexual intercourse, urination, or bowel movements, can exacerbate the pain. If you experience this type of pain for several weeks, especially if it's new and different from any pain you've had before, it's essential to get it checked by a healthcare professional. Number 3. Bloating. If ovarian cancer blocks your lymphatic system, the part of your immune system that moves lymph fluid back into your bloodstream, the fluid will not drain correctly and may collect inside the abdomen. This fluid might make your belly swell and extend outward. Bloating can be a symptom of various medical conditions, and while it can sometimes occur in ovarian cancer, it is essential to remember that bloating alone does not necessarily mean a person has ovarian cancer. Ovarian cancer is often referred to as the silent killer because its symptoms can be subtle and easily mistaken for other less severe conditions. Bloating is one of the most common and noticeable signs of advanced ovarian cancer. Due to a buildup of fluid ascites, a woman's belly can become swollen and distended. The bloating may be accompanied by pain or an uncomfortable feeling of tightness around the stomach, as well as indigestion and an increased need to pass gas. Additionally, the resulting pressure on the stomach can cause loss of appetite, while the resulting pressure on the lungs can cause shortness of breath. However, persistent and unexplained bloating, especially when combined with other symptoms, should be evaluated by a healthcare professional to rule out any underlying health issues, including ovarian cancer. Persistent pain in the pelvic or abdominal region, which may feel like pressure or an ache. Sensation of feeling full shortly after eating, even if you have not eaten much. A noticeable change in appetite, either a loss of appetite or feeling unusually hungry. Frequent or persistent bloating, often accompanied by a feeling of fullness even after eating small amounts, is another symptom that should not be ignored. Many women experience bloating from time to time, but if it's severe, doesn't improve, and lasts for several weeks, it's best to get it evaluated. Number 2. Changes in bowel habits. Constipation is one of the most common ovarian cancer symptoms. You should be particularly concerned if the initial measures you take do not relieve the new constipation. Patients may also experience upset stomachs, diarrhea, and other digestive changes. It is important to pay attention to any changes in your bowel habits. Changes in bowel habits can occur in women with ovarian cancer, but it's important to remember that these symptoms are nonspecific and can be caused by various other conditions as well. If you or someone you know is experiencing any of these symptoms, it is crucial to consult a healthcare professional for proper evaluation and diagnosis. Ovarian tumors, especially if they are large and growing, can exert pressure on the intestines, leading to changes in bowel movements, including constipation. In some cases, ovarian cancer can cause changes in bowel habits that result in diarrhea. This can be due to tumor-related factors or interactions with the digestive system. Unexplained changes in bowel movements, such as constipation or diarrhea, that persist for more than a few weeks could be a sign of ovarian cancer. Pay attention to any sudden shifts in your bowel habits, as well as a feeling of urgency or a need to go more frequently. Number 1. Frequent urination. An increased urge to urinate occurs when ovarian cancer cells have studded the outside of the bladder wall or when ascites in the pelvis compresses the bladder. Frequent urination can be a symptom of ovarian cancer in women, but it is not specific to ovarian cancer alone. There are many other conditions that can cause frequent urination, so it's essential to consider other symptoms and consult a healthcare professional for a proper evaluation. As the tumor grows in the ovaries or nearby areas, it can put pressure on the bladder, leading to an increased urge to urinate. Ovarian cancer can cause fluid accumulation in the abdominal cavity, ascites. This can also exert pressure on the bladder and lead to frequent urination. If the cancer has spread to nearby organs, such as the bladder, it can directly affect bladder function and cause increased urination. If you find yourself needing to urinate more often than usual, and this symptom lasts for more than a few weeks, it could be an indication of ovarian cancer. The urge to urinate may also feel sudden and intense. That's all for today. Leave your valuable feedback in the comment section below. Don't forget to subscribe to this YouTube channel before you go. Thanks a lot for watching. Until next video, stay tuned.